The Opus nasal pillow mask from Fisher and Paykel is an excellent choice for nasal pillows. For many people. You have your headgear, the frame, the pillow itself, which comes in small, medium, and large. The tubing can pop out, and has been one of the complaints when it comes out too easily, because people might sleep roughly and pull on the tubing and pull the tubing off of the frame. But for the majority of people, that is not a problem. It pivots nicely, and it has holes here, allowing the carbon dioxide to come out of the mask. You should never block any of these holes. Don't duct tape them. The headgear, it does matter which way it goes for fitting on your head. One side is longer than the other, and if you get it upside down, it can make the fit of your mask poor. It just doesn't fit right. It won't feel right. Oftentimes the new mask has a Velcro attachment here where you can run the tubing up over the top of your head. The majority of people don't like to do that. However, it's nice that it's an option. As you can see here, it shows the Velcro at the top of the person's head and how the tubing can run over the top. The nice thing about that Velcro at the top is it reminds you which end should go to the top. Even after cleaning, if you take it off of the frame, how do you know which way that goes back on? And for some reason it does matter. The frame has the name of the company here and the name of the mask there. It also has arrows pointing up here, which is very important, because one of the common mistakes is to put your pillow on upside down. See, it works quite well, like so. It doesn't work so well, like so. It's important to run your pillow up. If you look for the arrow, and your pillow is going up this way, you have it in the right direction. If you put your pillows on like so, and they're running more straight out as opposed to up, it won't sit right in your nostrils. When you place the pillow in the frame, you can see a track. It's not good enough just to shove it in the track. We need to balance the knob, the button, this bump. That knob balances in between, straight down the center of the two pillows. Like so. So when you put it in, you can't shove it in yet. You have to line it up first. Once it's lined up, shove it in there. Nice and snug. All the way to the edge. All the way around. And now, the bump is in between the two pillows. If that is crooked, that will increase the chafing of your nostrils, creating a little bit of pain on contact with your nose. It also will create more leaks. As you can see, there's some padding here. Some people who have said they wear the frame, the padding's not quite enough, they get these marks on their face. I suggest you cut off a pair of the toes of the baby socks and slide the leg of the sock here and the foot there, and those socks will minimize the markings on your face. And also it makes when you sleep on your pillow, if this frame is on your cheekbone, it can make it softer to where it doesn't hurt your cheekbone as much. When you put your mask on, well, first when you take it out of the package, you will notice that these straps are in all kinds of crazy places. And if you slip the mask on at that point and adjust from there, you will never find the best placement. When you get your mask, undo the Velcro and slide it all the way back to the beginning. All 6 of them. 1, 2, 3, 4, 5, and 6. You put it on your face. Put that right up in your nose, not, you know, an inch out of your nose. Get it right up there. Snug up the back first on Velcro and tighten the back. Even Steven both sides. Same distance. Second, do the top. Once again, even Steven, same distance. And it should mostly be in place. Now some people, most people, don't have nostrils that are even. You adjust these on the side for fine tuning. That's a fine tuning. So if you still have a little gap between your nose and the cushion, then snug that up a little bit. You don't want to have to tighten both sides really tight and shove your nose up. If your nose is shoved up, it will cause more pain, more discomfort, chafing. So when you place this on your nose, it should seal right to your nose like a nice little button. Sometimes people have the wrong size cushion. If it seems to be falling in your nostril or caving in a little bit, upgrade to the next size and see if that does better. If it seems to be bulging and pushing, it could be too big. Try the size down. The good news is each package comes with all 3 sizes to make sure you find the one that works for you the best. When you clean the mask, first thing you do is you wash your cushion daily. Boogers will chafe your nose more. So wash that daily and rinse with dish soap at the sink in your bathroom and leave it to air dry for the day. Once a week you wash the whole thing. Wash and rinse, headgear and all, and hang it up to air dry. This is like diver suit material. It's designed to be washed, and you don't want to get oils and dirt and all that in there and have a stinky headgear. So throw that all in the sink of soapy water and wash and rinse and hang to air dry. Oftentimes the part that you need to replace the most is just this cushion. You know, you might get it and 9 months later that's the part that it just doesn't seem to be as soft as it was when you originally got it. Once the Velcro starts to wear out, you replace the whole thing. As a side note, that is called a quick disconnect. Most masks have quick disconnects. It's kind of a source of frustration for me. Really a moot point. People don't use them the way they were intended. It was supposed to be that you could disconnect your mask from here and with it in the tubing and go to the bathroom. Then when you come back, so you don't take the mask off your head, just disconnect from there, come back, reattach, and go back to sleep. Well, it's actually quite easier just to disconnect the whole thing from the tubing and go. The problem is, let's say you got this mask and this is stuck in your tubing. Then you go get a different mask and it won't fit in there. That's because this doesn't belong with any other mask. It only goes with this one. Get it back out of your tubing, put it back on the mask where it belongs, and then your tubing will be soft and open and ready for anything else. A good pointer is when you get this mask to go ahead to the go to a pharmacy and purchase some air gel, AYR, air gel. It's aloe based and brush the gel on your nostrils during the day when you're not wearing the mask. That will help with the chafing in the beginning until your nostrils toughen up. About 2 to 14 days later you won't need the gel. Some people revert back to it on occasion. Many don't need it ever again. If you still need the gel after 2 weeks or 3 weeks, possibly pillows may not be a good idea. Your nose may be too sensitive and it's not toughening up. You might need to go to an around the nose mask. This mask is great for people who have problems with congestion. The airflow is very laminar. It's very direct. If you have polyps, deviated septum, narrow sinus passages, the flow from this mask will cut through that. And some people who cannot breathe on an around the nose mask, they just can't seem to get the airflow in, they do wonderfully getting the air with this. Other people, they don't really like the directness of that airflow. It feels a little overwhelming. You know, it truly is about personal preference. However, if you have problems with sinus congestion, deviated septum, polyps, blockages, this would be an excellent option to try.